Knock, knock. Hi, Joe. My name is Tony Pillow. I'm a student here at Southwest Tech, and we're taking care of you today. Is that okay? Okay, good. Well, let's get started. Let's get a little privacy for us here, Joe. I'm going to come over here and wash my hands. And let me get some gloves on here. Okay, Joe. Looks like we're going to be doing some enteral, give you feeding today. Enteral tube feeding. Is that okay with you? Okay, good. Well, let's just get started here. Now I want to confirm that we got the right doctor's order, Joe. Clean but not sterile gloves. Okay, Joe, date of birth. 10/5/53. Okay, and your full name, Joseph Smith. Okay, any allergies, Joe? Sulfa. Okay, not using any sulfa today. We're good that way. Let me just double check your wristband here. Very good. Okay, we've got the right orders. Okay, Joe. Yeah, well, let's just see how you're doing here. We're gonna go ahead and do this. Okay, so I want to come over here, Joe, and we want to make sure you have your bed in the right position. Now, what that right position in your case is, we want to have a fowler's position. We kind of want to maximize that. Make sure that you're mostly upright as much as you're comfortable with. If you were unconscious, Joe, we could also do something with right. We could lay on your right side and do this, or if you were in a chair, we could do it as well. Okay, but you're comfortable like this. So let's do this. Next thing I want to do is I just want to double check and see how your hose is. It's real easy for these to come off of your nose, and we don't want that to happen. So I'm just double checking and fixing that if we need to. I see you are connected well with your gown as well, so that's good. That's good. Okay, very good, Joe. The other thing we want to make sure to do before we do any feeding is, well, there's a couple things, but one is I just need to do an abdominal assessment, kind of like we've done in the past. So if you don't mind, I'm just going to check, and we're just going to palpate around here, around your abdomen. And that should be soft. You know, it shouldn't be any bulging. It shouldn't be, too firm or anything like that. It kind of bounces back within a touch, and that feels good. The other thing I'm going to do is I'm going to oscillate or listen. And I want to listen to all four quadrants here, Joe. And what I'm listening for is I need to hear some gurgling or some gastric noises in all four quadrants. I'm going to do lower right, okay, upper right, upper left, gurgle, and lower left. Okay, good. So we got good noises down there. Sure sounds like anything's fine. Everything's fine. And do you feel okay and everything? Okay, good. I think we're going to go ahead and go with this. So, discuss the position. And we've got you where you need to be. I'm going to come over here and I'm just going to check this with the Mars. And what we're going to do, we need 100 mils of Gevity, it's called. And with that, we flush first. We flush for 50 mils. And then we do 100 mils of the Gevity. And then we flush for another 50 mils to make sure that the tube is nice and clean. Okay. And that 50 mil is just water. Okay. So I'm going to come over here and I'm going to measure out my 100 mils. And this 100 mils of the Gevity, okay, this is actually my first check as well. And this is at room temperature. You don't want to give super cold Gevity liquids like that. Okay. Set this down where we get a good measurement. Okay, we've got 100 mils of Gevity. I've got my water right here. The expiration date is good on the Gevity, and it's not super cold. So the expiration date's good. The med is good. It checks out with the MAR. The MAR checks out with the doctor's orders. Okay, we'll come back over here, Joe. Well, the first thing I need to do is I'm going to aspirate. What we call aspirating. I want to make sure that this bottom of this tube, which we can't see, is in the proper place. I'm going to pull up here, connect my syringe. And I want to pull up. There's a little bit of air there first, so I want to make sure that we get a good 5 mils or so. Okay, I've got 5 mils of liquid in here. This liquid should be a gastric liquid. So there's a couple different ways we can check that. You can kind of get some ideas from the color of it, kind of greenish, yellowish. But the other main ways we want here, I'm going to pull up we're going to be checking, we're going to be running a test on this to make sure that's gastric juice. Okay, if I pulled a bunch more out of here, which I can't do, that's also a sign that maybe you're not digesting or that the liquid's going in the wrong place, because you should be digesting. It's been a full 4 hours since we've done the feeding, so some of that should be settled down now. So what I do is I take this 5 mils, and I'm just going to come over here. I've got what we call litmus paper, and put a little bit on the litmus paper, and we check that. That should be anywhere from 1 to 5 for a pH, and that's a higher pH. If it's higher than 1 to 5, we might be getting a liquid from somewhere else in your body. But we know that stomach acid is a little bit acid, so that's what's going on there, is that higher pH. Excuse me, the lower pH of 1, 2. It should be, it's coming out as a 3, so that's okay. So I want to come back here, and I'm just going to put this back in where we got it from. Okay. All right. And we'll let that drain down, and that's good. Okay. I'm going to come back here, Joe. I'm going to do my second check. So again, I've got, keep moving. I got 100 mils of the Jevity. It's lukewarm and the expiration date is good. That checks out with the MART. That checks out with the orders. I've got some water here as well. Lukewarm, excuse me, room temperature. So that checks out with the MART as well. So we're good that way. On that note, as always, I got to explain the 5 rights to you, Joe. We got to make sure we got the right person, the right timing, the right medication, the right dosage, and the right way to administer. And that's what we've been checking here all along. Okay. That being said, I'm going to go ahead and do my 3rd check now. So I come back here. We got 100 mils of Jevity. 100 mils of Jevity. If the expiration date is good, expiration date is good, and it is the right proper temperature, which is room temperature, and we got room temperature. Water's room temperature as well. So we're going to go ahead and get started here. I'm going to come over to this other side of me here. If you could just hold still, I'd appreciate that. First thing I'm going to do is I'm going to give it the flush. So I'm going to take the plunger right out of the syringe, and we're going to do the 50 ml flush. I'm going to hook this up to the tube, and I'm going to temporarily disconnect this. That's going to give us a little bit more height so that we can pour this a little more easy. So the gravity works with this a little better. I'm going to put in 50 mils of water. Good. All right, and that's just going to flush the tube well. Give it a little pinch, get it running good. Okay. There it goes. It's going good now. All right, now that's going down. And right when that comes to the end, I'm going to back that up. Now we got there. I want to, there we go. Good. And we got, this is our 100 mils of Jevity. And that's going down good. I try to do that right back to the water so we don't get extra air bubbles in there. And we're getting good flow on there. Okay. Now when that gets down, Joe, at the very end, we're going to flush this out with another 50 mils of water. That's that. Now we did the pH test. The other two tests we could do, we could test for bilirubin, and we could also test through an X-ray test if we had any doubts. But we were sure that we got the pH proper. But again, those other two tests we could have used as well if we had any question that our tube was not in the right place. Okay. Now I'm going to place this back here. And I want to fix this right to your gown. I want to make sure that you have enough room where you can still move your head nicely. The gown might get pinned or might not, depending on what facility you're at. Just to make sure that the tape gets stuck to your gown and you're fixed properly on your nose there. The only other thing I ask you to do, Joe, is that we've got to make sure, I want you to stay up in this position here for the next 30 minutes. That's going to make sure that everything stays down where it should stay down. Okay? Okay, well, thank you very much, Joe. You've been a good patient. Is there anything else I can do for you? I've got time. No? Okay. Have a good day.